excited to have two great friends joining me for Transforming Healthcare. I'm Will Barsoom, and today I'm joined by Ben Jarvis and Jason Sansone, two of the founding members of a new practice up in Wisconsin. One of the things that's extremely unique about these guys is they went from a large multi-state healthcare system to a practice that they built from scratch. And they did it with 11 partners that all came out together. So definitely a challenging opportunity, but has led to some really amazing lessons and extremely successful practice. So I'm very excited to have Jason and Ben here with me today. And we're going to hear about their story. We're going to hear about the pitfalls of starting from scratch, and we're going to hear the success stories and why they chose to do it. So please enjoy this podcast. Again, Transforming Healthcare. I'm Will Barsoom, and we're proudly sponsored by HOPCO, Healthcare Outcomes Performance Company. So thanks for joining us today. Jason and Ben, thank you very much for taking the time to be here. Really appreciate it.
Thanks for the invite. It's humbling to be asked to do this.
No.
Thank you very much.
Of course, of course. So the first thing I'd love to ask is, how do you get to where you are today? Right? I mean, did you wake up one day and you say, I want to be an orthopedic surgeon? I know you didn't wake up and say, I want to be a spine surgeon, because you started off as a trauma surgeon, right? Same for you, Ben. You know, how did you end up, obviously, in the role that you're in today? So, Ben, why don't we start with you?
Sure. Grew up in rural northern Wisconsin. My dad's a pharmacist, ran his own pharmacy. Went to the University of Wisconsin not knowing exactly what I wanted to do. Came home one day and said, I want to go to school to be a business leader in healthcare, and realized in my mid-20s that that was a thing. Fortunate to get into Rush University here in Chicago, where we are today, and got my master's in health systems management there. Was fortunate then after that to get a administrative fellowship here in town, and then found my first job in orthopedics, managing a practice here in Chicago. Shortly after that, wanted to move back to Wisconsin, and my wife and I transitioned up to Madison and took my first position as a practice leader up there. And then just a couple of years after that, met Dr. Sansone and started leading the orthopedic practice for a large system there. And then we'll probably get into a little bit of the evolution from there to today after I let Jason introduce himself.
Great. So one thing I have to ask you, I've noticed a lot of pharmacists that get into healthcare administration. And it's interesting to me because, you know, Ozzie Delgado, obviously, you know, who was HOPCO's chief operating officer before becoming the CEO of FIU Health, is a pharmacist, right? And still very proud of that lineage. What is it about pharmacy school that kind of positions you guys for this? Because it seems to not be an uncommon occurrence.
Yeah. Well, I think for me, it was watching my dad be a pharmacist, president, HR, legal. I mean, he did everything from supply chain, owning a mom and pop pharmacy in a rural northern Wisconsin market. Led me to show me that it's more than just, touching the patient or just delivering the prescription. There's a lot more to it than that. And so I think watching him develop, his leadership style and running a community pharmacy instilled a lot of those values in me. And so when I was doing my undergrad in a medical field for an undergrad, it made me realize that I can have a major impact on the healthcare of my community through a multitude of ways in leadership. And so I think that's how I learned that path was one way to touch a lot of lives through healthcare leadership.
That's terrific. That's terrific. Jason.
Yeah, and I got to say, just to compliment Ben, he is one of the few healthcare administrative leaders that I've ever worked with who truly leads with his heart. The patients matter to him. He's on the phone with them. He cares deeply about what we do. And it's really, from our perspective, it's worth its weight in gold. It's a huge asset to our organization. But yeah, my story, so I grew up in, you'll notice a theme here. We born in Wisconsin. We suffer through the winters in Wisconsin, and we stay in Wisconsin. But born in Waukesha, which is a suburb of Milwaukee. Parents were both teachers, so education was always important in the house. And when I was a sophomore in high school, I had the opportunity to shadow a local surgeon, actually a spine surgeon, oddly enough, and walked into the operating room for the first time as a sophomore in high school. Didn't pass out, and thought, this is an environment I want to work in for the rest of my life. And so that became the singular goal, and ended up going to medical school, residency, and undergraduate in Madison. Left for a year, did a trauma fellowship in San Diego. Still wonder why I left San Diego some days in the middle of January, but then moved back to Wisconsin, where family was, and It's just it's a state where there's a lot of genuinely good human people, human beings.
Yeah, that's definitely been my experience when I've come to Wisconsin and visited there. I mean, the people are good, kind of Midwest people. I'm a Clevelander, so I come from the same place. I mean, it's just wonderful to be able to serve a community where you feel appreciated and you feel like you're really making a difference, right? Yeah. So, no question. So, a lot of different models in healthcare today, right? Especially, for physicians, right? You've got employed models, you've got private models, you have private practice models, lots of different things. And obviously, Jason, you've gotten to experience a couple of those, right? So maybe touch a little bit on kind of your start. Obviously, you were a leader at a large system, and decided that you needed a change or you wanted to change, right? So talk a little bit about kind of what you enjoyed in the employed model versus maybe what kind of drove you to decide I'm ready to make a change and this is what I'm going to do, because what you did is hard, right? I mean, and I think obviously having been at your side made a real difference, but what you guys did together is not easy, and I suspect there are a lot of doctors out there that are thinking, what are the steps to leave an employed model and start on my own? I'd love to learn about that from you.
From Ben's perspective, he thought he met me, and then pretty soon thereafter, a few years, his life was in shambles. But really, so I took as you were saying, I took a job as an employed physician. And really, if you'd have asked me 3 years into my career what I would end up doing with my career, I would say, I'm going to stay here forever. This is wonderful. And over time, I think any new young surgeon, as you're starting your practice, after about 5-7 years or so, you start to ask some deeper questions about what you want to see your career path, how you want to see that unfold. So at the time, I was the chairman of the department for the corporate entity locally, and I also became the system director for MSK from across a wide swath of multiple states for the organization. And Ben was my administrative dyad partner, and so we worked together. And as I began to peel back the layers within the organization and to try to impact change in moving towards more of an incentive-aligned, value-based care type of healthcare delivery system, it became very obvious to me that that was going to be, unfortunately and tragically, impossible within the system that I was working. And at that point, I had a choice. I mean, right, family, 2 children, nice house, getting paid well, kind of had things grooving from that perspective. And for me personally, it kind of came to this spot of, one, as a leader, I can no longer look my partners in the eye and tell them with any type of confidence that things would get better. And 2, from my own perspective, I thought, is this really all there is? Maybe there is. Maybe punching a clock, so to speak, and just going to work and doing my job is the extent of what I can expect from my career. But I had a feeling that there would be more, that there was more, and that I would be able to derive more joy from doing it a different way. And so I think the first step is to know yourself, and the second step is to know the group of people that you have all around you. When I was chairman of the department in Wisconsin, we had 2 rules, and it was you need to be a good human being and you need to be a good surgeon. And if you can check both those boxes, you're in the group. And if not, then we will manage you out of the organization if you're unable to be managed up. And so, I put my money where my mouth was, and we removed 5 surgeons from our group over time. We were left with a group of extremely strong surgeons and excellent human beings. And so when we started to talk as a group collectively about, hey, this is difficult here as employed physicians, what are our other options? It really came down to, hey, we're kind of a band of brothers here. In our case, we have all male orthopedic surgeons, which is not necessarily recommended, but it's the way it has been. And we started just having conversations about what our various options were, and did our due diligence, and elected ultimately to leave employment. But yeah, when we started, I mean, we essentially had an empty office space, and we were eating Jimmy John's and drinking Busch Light, sitting there on January 1st.
Hopefully not seeing patients and drinking.
No. At that point, we didn't have anything. And this was on January 1st of 2023. And at that point, we're literally wondering, how do we get computers in here? How do we get a phone system up and running? How do we get contracts? How do we basically function as a medical practice? We had no prior knowledge about how to go about doing that. And so that's where we really relied on a partner, and where Ben's expertise came in. We ended up partnering with Hopco, which basically brought to bear the entire suite of back office services, strategy, decision support, data analytics, RCM, contracting, IT, EMR, all the things, so to speak. And I was happy and pleased to be able to continue to pluck Ben along on our path, because we've definitely relied heavily on his expertise as well as that of Hopco in this transition.
So Ben, this probably wasn't easy, right? I mean, you're setting up shop, you're probably trying to buy some billboards, get the word out, hey, we're here, we're ready to go. And at the same time, setting up a computer system, a network, training people up, hiring a full staff of folks to check patients in, trying to get in network with some of the payers, right? None of these things seem to be terribly easy to me.
Correct. Hard is the easy word to use, right? It was hard, it was challenging, but I think that's what drives and motivates both of us, as well as the physician partners. And so from day one, like Jason said, it was the 12 of them and me sitting in a room, and we wanted to see patients as soon as possible. And that involved all those things you mentioned and more. And so within 6 to 7 weeks, we were able to see our first patient. And that was through just incredible hard work by all the physicians, and then the folks we were able to add to the team using that same formula. Are you a good person, and do you do good work? And so we hired 6 or 7 people, and we had 6 or 7 people supporting 12 physicians to start. And I think we saw 11 patients that first week in our practice, and now we're seeing thousands per month in a pretty short period of time. And so a lot of hard work, but we could not have done it without Hopco. We still, today, we have around 20 or 21 providers, including our therapists, our PAs, and our physicians. And I think we only have 19 staff locally in Wisconsin because of all the great support we get out of Arizona and the other areas that Hopco helps serve. And so couldn't be done without all that. And it's everything from revenue cycle, payer contracting, supply chain, IT, and the list goes on. And so still meddling all that together and allowing it to do what we do on a day-to-day basis, and seeing all these patients and treat them across multiple health systems now that we've spread out to in South Central Wisconsin is nothing short of a lot of hard work and effort.
So things like blocking and tackling, right? Getting privileges at a hospital, thinking about ASC presence, rooming patients, right? Really simple things, right? Did they turn out to be harder, easier than you expected, about what you expected when you were making the move? I mean, how was that for you?
Yeah, it's interesting. Some of the pieces, my anticipated difficulty was spot on, and other pieces of putting together a practice were shockingly difficult. So, as example, the contracting piece and the interfacing with insurance was exceedingly difficult, and clearly would not have been able to do that on our own without a partner. The day-to-day stuff, insofar as the rooming of patients and seeing folks and documenting, that kind of is fairly standard approach. As long as you get the right people in there, you can do that work. But I think the biggest thing in addition was, as you mentioned, as we started contemplating bringing PT on board and marketing strategies and decision support for when to pull the trigger on starting a surgery center. How big to have the surgery center? What size property do you purchase for said surgery center? Do you do a rebuild, or do you do a new build? I mean, all of these questions that come into play. How do you run the supply chain? We would not have been able to do that in a fiscally responsible way without the help of people who had done this before. Because anybody can buy a piece of land and build a surgery center. The question is, are you doing it in a capital efficient manner? And that's been, I think, the real value proposition here for having a partner, which is you cannot do this alone. And don't kid yourself in thinking that you can do it alone. It's exceedingly difficult, especially with the current marketplace, how it changes so often.
Yeah, no, I think that certainly makes sense. And I suspect some of that blocking and tackling probably fall on your shoulders, Ben, right? I mean, trying to...
Pretty much all of it.
Not true, but yeah, when you I was very fortunate to surround myself by the physicians who are some of the best at what they do in the region. And that allowed me to recruit and find people that were just addicted to being part of a system and an environment that is so supportive and is so rewarding to see what they do for the colleagues and friends and people in the community. And so by continuing to surround yourself, we lead culture, and we talk about it all the time. We lead culture in Madison for our group, and it is attractive to those who want to be part of it. And by doing that, and the way I think that we've had success doing it is just creating some momentum and to continue to be able to grow. And we've spread it probably about 50 to 100 miles around Madison. And it took some time and it took a lot of hard work, but as we had success at one partner hospital and one partner clinic, other people started to call us, whereas at the first 6 months, we were reaching out, we were calling them to say, hey, where can we bring our services? Where can we help? But between 6 months and a year in, they were calling us. And then we started to be able to pick and choose what are the right opportunities, what are the right facilities, what are the right physicians and colleagues that are, attached to MSK Care that we wanted to be aligned with and we wanted to facilitate partnerships and growth with. And then we could choose, hey, we should start covering call for that facility because that'll help, grow our business and attract the right patients and the right people and the right colleagues to the OSCW ecosystem that we've started to build in South Central Wisconsin.
And what are some of those partners, the partners that you've really felt, man, we've hit it out of the park with this group? I mean, they're great system, they're engaged, they see the big picture, they appreciate the work that we're doing.
Yeah, the list is growing. I think maybe the first one was Edgerton Hospital and Health System in Edgerton, Wisconsin. They did not have an orthopedic practice before they partnered with us, and so also a challenge, but really fun to partner with a hospital that wanted to get into orthopedic care in a relatively rural market. And so we started there. From there, Southwest Health in Platteville added to their ability to have fellowship-trained, subspecialized physicians in a rural market. Marshfield Clinic Health System up in Beaver Dam, Marshfield Medical Center in Beaver Dam, wanted to augment their ability to cover call and keep patients local rather than shipping them up to a larger center. Watertown Regional Medical Center had a transition of orthopods going on and also wanted to be able to have subspecialty care, fellowship-trained care in their center. And then also Upland Hills Health in Dodgeville had one physician, still do, a great physician there, but wanted to be able to bring in subspecialized hand and upper extremity. And now we just added spine care, and Southwest Wisconsin has no other spine care in Wisconsin right now. So between Dr. Sansone and Dr. Tom Zadeblik, we've brought spine care to places like that. And Beloit Health System down on the border also started their spine program last year. And so the idea there is that we want to have it so that patients don't have to travel 50 or 100 miles to have that high quality subspecialized care when we can go to them and spread and grow and make it a heck of a lot easier to get that level of care in the communities that they live.
It seems like the common theme in the successful partnerships that you guys have forged is the fact that the healthcare systems are so committed to their community and to the patients in their community and making it easy for those patients to get care locally in a high quality healthcare system partnered with high quality providers. Is that a fair assessment?
Yeah, I think it's fair, and I think one of the reasons why they've been successful is because we approach these partnerships as true partnerships and sit across the table from these various health systems and say, look, how can we both win here? We want to support you, you want to support us, and we don't make demands that are beyond the scope of what we think the value we bring to the market is. We tell them from the get-go, look, this is something we're going to do synergistically, collectively. We want to see this succeed. And I think just like in any industry, right, the basis of success really boils down to simply communication and trust between parties. And I think if you lead with your heart and people understand that you're doing this for all the right reasons and you want to see excellence in patient care, over time those relationships really blossom, and you end up making new friends, great business partners, and having a really enjoyable relationship over time as it evolves. And they all have evolved and grown quite substantially since we've started these partnerships.
Yeah. Well, you know, Jason, Ben mentioned a name that for any orthopedic surgeon that's listening, or certainly any spine surgeon that's listening, is a world-renowned name, right? Yeah. Tom Zadeblik, right? And he was your chairman.
He was, yeah.
And after going out and starting on your own, you end up recruiting your chairman to join your group, who's a world-renowned guy. I mean, talk about a stamp of approval.
Yeah, no, that was surreal. So when I was a medical student, I rotated with everybody calls him Z, but Dr. Zadeblik on his spine service, and ended up landing a position in residency at University of Wisconsin. So we had always stayed in touch over the years, and we'd had coffee quite a bit during the time frame when we were leaving and starting our practice, and just kind of bouncing ideas off one another, and I think commiserating about life in big healthcare systems together. And yeah, when he said he wanted to come over and join the group, I think my first thought was, oh my God, I'm scared, because and then he kept referring to me as his boss, and I still, when he does that, I'm still like, Z, listen, nobody's your boss, but he's been fantastic, so much so that that a year and a half into being open, I decided to do a spine fellowship in the middle of my career and reinvent myself again, which I think I'm done with the reinventing myself piece.
But great timing.
It was great. It was great timing.
This is still building. You've got time, right? You don't normally get an opportunity like that.
Yeah, and especially to learn from someone like him. I mean, technically, he's extraordinary. I've only worked with 2 really technically gifted surgeons in my career, and he's one of them. He just has this great way of teaching, and he's fantastic technically. So it's been so much fun to learn from the best of the best. And hopefully my practice is at least somewhat reflective of that standard of excellence.
Oh, that's great.
Yeah.
Well, I have to tell you, I mean, so when you guys left, there were 11 surgeons.
Yeah.
Is that right? And I'm sure the question everybody's thinking is, how'd you guys make money, right? I mean, for you're seeing 11 patients in a week, that's putting that's not paying the bills, right? I mean, so. Again, I mean, kind of blocking and tackling. How do you set yourselves up so that you can put food on the table, so your kids can go to school and get new shoes as they're growing, right? I mean, again, simple things, right? Line of credit versus savings. How do you manage those kinds of things as you're thinking through these moves?
Well, through a few of those avenues that we've discussed, the professional service agreements at those community hospitals that were looking for services to add to their repertoire of a hospital or a health system in those markets was one of the ways that we quickly were able to. I don't obviously take call. I'm not a physician, but I can volunteer Dr. Sansone's time to take call and find a revenue stream through.
Well, he's got a lot of free time.
Yeah, right.
Yeah, exactly. Yeah.
But no, all of the physicians that I work with were chomping at the bit to really get back to work, right? And so by taking call and adding professional service agreements to grow those partnerships in those different rural markets was probably one of the quick ways. But you have to have a really great relationship with local lenders and banks, and so we were fortunate to come across a local bank in the Madison area that's been super supportive. Wings Credit Union, they've done a great job for us, and then slowly build through the PSAs, call agreements, and just other avenues of and then over time you add physical therapy. We just did that recently. You do a little bit more imaging, you do a little bit more PRP, and you add technology and my recovery applications from HopGo, remote therapeutic monitoring. We found a few different ways over that first year to really add enough revenue to keep the lights on while our practice is organically just growing and growing. And that's, we're starting to see that hockey stick effect. And with the ambulatory surgery center coming online here in a few months, I think that's going to really enhance that. So I think the toughest of times were in that first year, but we were definitely getting through that. And our culture helped us all stick together.
Yeah.
But there were definitely some challenging days in those first couple of years.
Yeah, I mean, to your point, the nice thing about the PSA type of agreement, professional services agreement, is that it's immediately cash flowing, right? So you're paid in our case, on a daily stipend of your time. And so at least at that point, we had some accounts receivable coming in while we're waiting for RCM to build up. And I don't even know that we got paid on a claim until June or July of that first year. And so that was our lifeblood when we first started out. But I think, as Ben was saying, and it gets back to, right, there's some dark days there. I mean, it's March and April, and you haven't seen a dime come into your organization yet, and all the surgeons took a nearly 75% pay cut to do this, and everybody's kind of looking at each other like, oh my gosh, did we make an awful mistake? And if you don't have a culture underneath that's extremely cohesive, it simply doesn't work. You have to be able to see through that and to stick together and to support one another. So I have gotten to know my partners on such a deeper personal level. A lot of times for the first couple of years, Ben and I were as much mental health counselor as we were business leader and clinician in my case. But there's tremendous value in that experience.
Yeah. One of the things we were talking about earlier is kind of this difference between complex and hard, right? And complex needs process and hard needs grit. And it seems like this is kind of a combination, right? I mean, setting up the practice clearly is complex and you need processes, but the staying power is hard, and that requires grit, right? I mean, I remember sitting in one of the meetings, right, with the partners. We were maybe 6-7 months into it, and everybody's kind of looking around and saying, what do I tell my family? When we got to make more money than this, right? It's just it's a tough go. But listen, a tribute to your leadership, right? Because the reality of it is, without strong leadership, this doesn't work. And if it doesn't work, you've really had to start over. I mean, and kind of tail between the legs and tough go. Probably a lot of folks would have to leave the market, I would even imagine.
No, you're right. And I think, I wish I had some grand lesson learned or some grand advice for how to be a good leader. And I don't know that I do. Other than to say this is a human business and it requires human connection and it requires a level of emotional IQ that allows you to lead with empathy, lead with humility, be forceful when you have to in certain situations, but also understand the partners that you have around you and really always be someone who, I think in both our cases, looks out for other people before we look out for ourselves. And I think if people understand that you truly love them as humans and you want what's best for them and the organization, they will follow. They will follow because everybody wants to feel like they're part of something greater than themselves.
Being authentic, and I think by doing everything ourselves has really gotten all the partners to just really codify the culture. I'm answering phone calls someday because we have 2 people at the front desk because we're so lean. We are still in a startup phase. We're installing lead doors that have to pass physicist tests to expand our imaging area.
If you want a custom lead door,
that's the guy.
We both of us. It's a team.
I love it. I love it.
But by doing those things, one, because we have to, but 2, because we enjoy doing it, it keeps the culture from the frontline staff to the mid-level provider staff to the physician partners and the physician vesting track employee partners, all just so aligned, and they see the train is going down the tracks, and they see where we're headed, and they see the light, and the light is closer than ever every day. But on top of that, just being so supportive of each other, we're also fortunate to have great families. My wife, my father, my father-in-law, all of us are just so fortunate to have such a supportive, cohesive work family and other family members around us that have gotten us here over the last 2.5 years.
Yeah. It's kind of interesting, right? Because a lot of folks go into private practice right out of training, right? And many, maybe not many anymore, but there certainly was a time where people would start practice on their own. They'd hang up their shingle and they'd go to town. But it's psychologically very different when you go from $50,000 or $60,000 salary to $150,000 salary, or income that first year, versus when you go, and take a 75% pay cut, right? It's different for you, it's different for your family, and it's difficult. So So looking back today, would you do it again?
Yeah, I would. I'm so much happier now, and I think the lesson that I learned along the way, which I think is important to impart to younger surgeons, but I also think that it's a lesson that nobody can really learn just by hearing it. They have to live it, which is you get to a certain level of income, and after that, it kind of it's not all wine and roses, anyways, right? And at the end of the day, I think, and there's certainly been research about this, that really what drives satisfaction and engagement with your career isn't the money aspect of it. It's autonomy, mastery, and purpose. I mean, those are the three things really that and I think it's true. And so the degree of autonomy that I and we have now, and this sense of purpose for this greater type of organization that's beyond just ourselves, is truly driving a lot of the satisfaction here. And yeah, there, as I say, I mean, there's some times when you're white knuckling it, and you're asking the question, are we even going to be solvent? And then now getting to a position where we've been cash flow positive for over a year now, is you can breathe a little bit easier and enjoy the ride at this point.
Yeah. And in truth, we did a lot of modeling before,
Yeah.
With the lines of credit and everything. And for starting from scratch, we were all pretty close to when the practice would become cash flow positive. I think we were off by a few months in the grand scheme of things. So
but when you're going through it in September, October, you're like, well, I sure as heck hope that's right.
Yeah. No, I think that's absolutely true. Well, let me conclude maybe with one question for each of you as kind of you think about it. I mean, you obviously started off as a pharmacist, so you went down a healthcare route. You as a physician going to medical school. I always ask folks, right, would you do it again? Would you suggest to your children that this is a great career? I know how I feel about it. For me, I think I love being a doctor, right? I still operate. I don't think I'll ever stop. I wish one of my 3 daughters would have gone to medical school, and maybe I still have hope for one of them. But not everybody feels that way. I do this with a lot of docs, and they say, no, it's not what I signed up for. It's not what I wanted. It's become difficult today. I don't like it anymore. How do you guys feel about that?
Yeah, 10 times out of 10, Dr. Barsoom, 10 times out of 10, because with the challenges comes the rewards once you break through and get to the other side. And when you're in a leadership role, you get to impact more than the person in front of you. You get to impact all the lives that the 13 physician colleagues and 4 AP colleagues and other PT colleagues affect every day. And so it is so rewarding, and also living in the community that, the clinic is 6 miles from my house. And so being able to say, hey, neighbor, uncle, friend, relative, go see these guys. They're the best. We'll take great care of you. It is so rewarding. So all the challenges are worth it, because it's something that touches every one of us through our lives. And it's a huge impact on my family, my friends, my community. I'm super fortunate to be in the position. So all the challenges are worth it to me.
So Ben, you just said 13 physician colleagues. So the practice started with 11, right?
Yeah.
So you've already grown.
Yep, and bringing on one more in a couple weeks.
Wow.
Yeah.
That's impressive.
Yeah. Yeah, it's amazing how it's really grown. But to your original question, I would do this all over again. I love operating. I love being in the operating room. It's a sacred place for me. It's a sanctuary. And as you know, I mean, clearly, Will, there's some days where it's difficult.
Oh, yeah.
There are some long days. Yeah, and one of the things I try to tell my kids is that in this family we do hard things, and that anything in life that's worth doing is difficult. And I think, so I hope that the next generation of physicians coming on and thinking about being a physician understand that, because I'm not getting any younger, and pretty soon I'm going to be a patient more so than a provider. But yeah.
You listen to music in your OR?
Oh yeah.
What do you listen to?
Well, it depends on the day. So I love kind of old school outlaw country. So get some Waylon Jennings and
Wow.
Willie Nelson going. On occasion, I'll do hip hop barbecue on Pandora because some days you just got to cue it up.
I love it. I love it. That's awesome. Well, guys, listen, I can't thank you enough. I mean, what you guys have done is unique. It's different. It's probably something that a lot of people around the country think about doing. And I think it's important for them to realize, right? The easy path here is just to go from one job to another. The tough path is to go from one job to start from scratch, right? Yeah. But it sounds to me like, at least in this particular case, it was worth the sacrifice and it's worth the risk, and you do it again, and that says a lot.
Well, and I'd be remiss if I didn't say thank you, Will, for the mentorship that you've provided over the last number of years. I think that's been really important to lean on the folks within HOPCO as well. You and Dr. Jakowski, Dr. Scalise, and so on and so forth. It's been hugely helpful as we've navigated this.
No, it's been a pleasure. So, guys, thank you for your confidence, and thanks for participating today. I suspect a lot of people are going to be listening to this and watching this podcast.
Yes, indeed.
Appreciate it.
Thank you.